Okay. Hello YouTubers, my name is Nico. I'm a pediatric dental hygienist. And basically I want to go over some facts that you should know about your teeth and a lot of you do not. But first, about me, like I said, I'm a dental hygienist. I've worked in a pediatric office for almost 4 years now, and I absolutely love my job. If I was working in an adult office, not so much. Adults, sometimes you could be so gross, your mouths and the smells that lurk. Anyway, I love the kids, they're fun. Some people say, ask me, is it hard working with the kids? Yeah, no, I only see them half an hour, twice a year. So I really can't get that hard. Maybe I've only been bitten twice, and I was only one with special needs, and the other one she was just crying and my fingers were in his mouth. So it wasn't intentional, but I love it. Give them stickers and they're happy all over again. A lot of you do not know what the roles are in the dental office. Like, nobody knows the difference between the dentist, the dental hygienist, and the assistant. So here's a breakdown. The dentist is the dental repair person, so to speak. They do the fillings, extractions, bonding of any teeth that's needed, all that good stuff. The hygienist, I do the cleanings and the x-rays. I'm the one you see every 6 months. The assistant helps the dentist, and the hygienist also, with instrumentation, and they assist during the dental procedures. Okay? So those of you parents calling me a nurse, yeah, doesn't exist in a dental office. Nothing wrong with being a nurse. That's just not what I'm registered in. Okay? Next, I'm going to give you a list of 10 things, and here they are. Toothpaste. Those of you worried about which toothpaste you should be using, or if the one you're using is appropriate, doesn't really matter. As long as it has fluoride in it, for those of you who are able to spit, which is usually those over age of 5. The purpose of toothpaste is for flavor and fluoride. Fluoride helps the prevention of cavities. What actually removes the germs off your teeth is the bristles. So make sure that you're not piling a whole lot of toothpaste on your toothbrush, because you're making the bristles so soft that it actually glides over the germs. It's not giving you the desired cleaning that you really do need. Okay? Yeah. Okay, get this. Those of you who are brushing or flossing and have any signs of bleeding, don't kid yourself. You have gingivitis. Okay? To prevent it, you need to brush and floss every single day. After about a week and a half of doing great brushing, great flossing, you see less bleeding, and eventually it comes to be so healthy that they will not bleed or be sore during your flossing whatsoever. Okay? I just don't want you to think that, little pink is normal. Yeah, no, it's not. Another important thing is what we call pregnancy gingivitis. Ladies, those of you who do not know, is during pregnancy your hormones are increased. And with that, any germs in the mouth will travel to the uterus. Okay, and it triggers a chemical called prostaglandins, and that will actually lead to premature birth. So, brush and floss, especially in your trimester. I'm not sure, a lot of you don't really know that, but it is very important. Okay, all right. And those of you who are pregnant or have morning sickness, after you get sick, rinse your mouth off and brush. That'll help neutralize the environment in your mouth. A lot of the vomiting will cause erosion or wearing away of the enamel. Also applies to those of you who are suffering with any eating disorders and working through it. Okay, please rinse afterwards and brush, and make sure you're seeing help for it. Any of you who have ever had any heart murmurs, heart diseases, surgical replacements, or any surgical pins placed, ask your physician if you need any pre-medicated antibiotics before your dental procedures. What can happen is, as the germs are being stirred up beneath your gums during your cleaning or during your your filling or extraction or whatever, those germs in the bloodstream can travel to that site of injury and cause future problems. So just check and make sure you don't need any pre-medication. Okay, that's a very important one. Another thing. Please stop saying soft teeth run in the family. Ugh, let me give you a breakdown of what you possibly are experiencing within your family. We actually have a germ in our mouth that helps promote cavities. Everybody has it naturally. Now those people who have more of this germ are more prone to cavities. They're the ones who have the best brushing, best flossing, and they still seem to get a cavity. Then there are some who have a lower amount of this germ, worse brushing, worse flossing, and they never come in my office with the cavity. They're in a lower aspect. What our germ naturally has, the acidic levels contain, sorry, I got an itch. Streptococcus mutans and lactobacillus. What does this mean? Fluoride can kill off this germ. Fluoride found in toothpaste. Act fluoride mouth rinse is really good. If you're very prone, if your whole family has a higher count of this germ, Prevalent 5000 works. Found at your pharmacies or local dental office. Another brand is Controller X. For kids, we use Gelcam. The Gelcam does cause a little bit of staining on the teeth. It's the ingredient that's in it that causes it, but it polishes off when they have the professional cleaning done. So parents have to decide if you want your child to have a small brown staining on their teeth or a cavity. Okay, so that's the breakdown of fluoride. Now, fluoride is poisonous. Too much swallowing of fluoride can cause white defects on your enamel. Especially for the younger kids who might be swallowing. So just be careful of that. Within the accurate measures of fluoride, it's absolutely awesome for your teeth. Those of you who thought or think you have soft teeth, brush, floss, monitor your diet, and fluoride is always awesome.